Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Sound Health has every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Nigeria reported the first case of COVID-19. The first case was confirmed in Cross River State. Today, we are looking at the re-emergence and what we need to know about prevention and precautionary measures. Stay tuned. The conversation begins after this break.
The program is a 3-year program and it involves training of health workers, providing mosquito nets and nutrients for malnourished children. We have also supplied equipment to primary health centers, as well as providing media information to the public. We believe that healthy mothers will produce healthy children and our nation will also be healthy.
Let's talk about nutrition in pregnancy and nutrition in children under 5. What is nutrition in pregnancy? Nutrition is everything that a woman needs for the growth of a baby. And it comes with diet. With proper diet, a child is expected to grow well in her womb, and then she needs that as the child is growing. For a child that is growing, a lot is going, and then a proper meal has to be produced for that child to grow properly. A child needs breastfed first 1 hour of birth, and this is called early initiation. During this period, that child has the advantage of taking the first milk that comes out, that is called colostrum. That's acting as the first immunization for the child. It happens for the first 1 week. Every child is expected to be breastfed for the first 6 months exclusively without adding anything, no water, no drugs. And also, proper breastfeeding also help with easy expulsion of placenta and proper evolution of the uterus. After 6 months, there's a iron gap, and that's why we actually also advocate for proper complementary feed with continuous breastfeeding till the child is 2 years. And in breastfeeding, it is important to note that there are 2 kinds of milk, fore milk and hind milk. And if a child does not enjoy both milk, that child looks as if he's not well fed. So the timing of breastfeeding has to be long enough for a child to be able to benefit from both the fore milk and the hind milk. Any child that has been breastfed for the first 6 months exclusively is expected to continue breastfeeding and have complementary food, and that is family meal. The proper and appropriate complementary food must have adequate diet. It must be available, accessible, affordable, and what is advocated is the food around the community that the child can join with the family meal for that child to have proper growth. A proper diet gives a proper growth, and a proper growth is a healthy future.
The program is still Sound Health on Lagos Television. We are being joined by Professor Bamidele Iwalokun. He is a professor of Biochemistry and Microbial Science, and he is going to tell us all he knows about the COVID-19 outbreak. Good evening, Professor Iwalokun, and thanks for joining us.
Good evening. Thank you for having me.
All right, Professor Iwalokun, a case of COVID-19 was reported in Cross Rivers recently. Tell us, what exactly do you know about this development?
Thank you very much. The first case was, which is very recent, was detected from a Chinese expatriate who came in by air into the country on the 17th of March. In April, he had moved to his workplace where he had come to Nigeria to work, precisely in a local government. Sorry if I'm not pronouncing it well. Something Kwankpa in Calabar. And then maybe developed symptoms related to COVID-19. And he was diagnosed to have COVID-19. So that was what we had. We also had that the Chinese expatriate was moved to University of Calabar teaching to isolation facility there, where he is receiving treatment. Even WHO called to an end Nigerian joint suit because we had 2 cases throughout 2024. So in 2024, COVID-19 ceased to be a public health problem and a global health problem. And we know that why it was so because of massive deployment of COVID-19 vaccines, even though coverage was not high even in all places, especially in Africa. We have the issue of the money to procure these vaccines en masse. Aside socioeconomic issues related to hesitancy, access to where the vaccine is, and fit. So this case in time is worthy of investigation. Very good to know that the government of Nigeria has taken steps towards that. A multi-layer surveillance has already been put in place, active in that local government, facility intensive in the facility where the Chinese expatriate was moved to, which is University of Calabar Teaching Hospital, and also the state has activated its emergency operation center so that there is a statewide surveillance that is based on reporting symptoms suggestive of COVID-19, symptoms like fever, headache, sore throat, running nose, and even blocked nose for diagnosis.
All right.
So, I must say that we've learned a good lesson from our previous experience of COVID-19 in that we did not, dismantle the structure that we put in place during that pandemic, especially in Calabar in this case. The case was able to be detected on time. So the diagnostic facility is still in place in Calabar. Isolation center is still in place in Calabar. And NCDC is presently doing further investigation in sequencing the virus.
All right. Professor Iwalokun. All right. So this is the first significant case Cross River State is reporting since the COVID-19 outbreak in Nigeria in 2022. Should we be worried?
We should be worried and we should not. I will start with we should not. We should not because in 2025, a total of 39 cases were reported on record. And this is the first case we'll be getting in 2026. So surveillance is still in place. Why we should not be worried is that, yes, many people have been vaccinated across states, not even, it varies. And it gives us an opportunity to convince, to communicate to those that have not been vaccinated to do so.
Okay.
I'm not worried because for those that are vaccinated and early, immunity has already been established. And that immunity is cross-protective to prevent severe diseases. So there won't be severe diseases. There could be mild symptoms and so on. I am also not worried. Because the current SARS-CoV-2 variant that is dominant is not the type that is capable of causing severe COVID-19, particularly in vaccinated and in elderly individuals. For immunocompromised with other comorbidities, there is still a need of convincing evidence to assess the severity of the current variants.
Right,
So I am not worried because the current variant circulating, so we are still waiting for what NCDC will report regarding the variant responsible for the first case in Nigeria that happened in Calabar. But what I would like to say is that the current dominant strain is a sublineage of Omicron variants.
Okay.
The Omicron variant emerged in 2021 and became dominant in 2022. The sublineage that we are talking about was actually the XEC variant. It emerged in 2024 and became dominant in 2025. We have not gotten a report of that in the country, but we should not be worried about the variant.
Okay.
In the sense that the variant does not, unlike the other variants of concerns, does not directly target the lungs. It only affects the upper respiratory tract, the throat and the nose. And what you get as symptoms from such effect would be headache, cough, running strokes, running nose. That is what you get. But the only disadvantage of that variant is that it has high replication rate and it has this tendency to transmit fast, if not. And not only that, even when you clear the virus, there is also a high tendency of having what we call long COVID. Long COVID, L-O-N-G, then COVID. So long COVID is what happens when the virus has gone, but the product that the virus leaves after infection, which is inflammation, continues to ravage and affects the brain. And what it causes is mental fatigue, a situation where a mild cognitive engagement, the person becomes very tired. The person may also have what we call a brain fog, not making the right decision at the right time. And occasionally, it has some neuropsychiatric implication. And that is what we should be afraid of. So it may affect behavior.
All right.
Some of this neuropsychiatric behavior like depression and anxiety in the setting of the long COVID.
All right.
We have had few reports of long COVID in Nigeria, and the percentage is about 4 to 5% or so. And that is what we should make intervention, prepare that such intervention in terms of educating them, that convincing them they don't have virus again, and these symptoms may happen, and in a few months it will go. And of course, some of the mild pains that can come, and I want to believe that that is what the Chinese expatriate is receiving. Pain, headache, fever, and they will do all these supportive treatment to get the infected person well. Yeah.
All right, Professor Iwalokun, quickly let us know the COVID-19 protocols. What should the public start doing in terms of prevention and protection?
Yeah, that's very good. It has not gotten to the stage of distancing to be kept and so on. But the first thing is the public should know that COVID-19 has not gone totally. That is one. The public should also know that for those that have not been vaccinated, they need to be vaccinated to get protection. The public should know this long COVID, that even when the virus is cleared, there is a tendency for a fraction that is not up to 5% to have brain fatigue, not necessarily damaging the brain. They may have exhaustion, mere thinking, and so they get easily tired. An occasional headache that may come as a result of that. And of course, another problem is insomnia. Long COVID has also been associated with insomnia, long COVID. But like I said, because we have to be very careful there, it does not affect everybody that is infected by the current variant. It's like 4 or 5%. So meaning that if 100 people were infected, 5 have the tendency to experience long COVID. With good management, it will go. Yeah. We have not gotten to the stringency of wearing masks, and so maybe that's what we are looking for. No, body immunity the infection is self-limiting. So, especially for those that have been vaccinated.
All right.
So they have this tendency to get report. Yeah, and to also form the habit of reporting in case they see a person showing symptoms of COVID-19, headache, runny nose, sore throat, cough. Such a person should be reported to the health or advised to visit a health center where they will do proper tests.
All right.
Yes, and public should also be assured that any center, because of the Calabar experience, I'm sure, even in Lagos State, the COVID-19 testing facility has not been disrupted. So anybody with these symptoms can feel free to get to their designated centers to get tested. Yeah.
In 1 minute, Professor Iwalokun, remind the public about the necessary precautionary measures for COVID-19 prevention.
Yeah, dear public, what I will say is, if you have not gotten COVID-19 vaccine in the past, go to the available vaccination centers and get a shot. Yes, COVID-19 has not gone totally, and most times it may be imported, because most of these cases are imported. We don't have local transmission currently. So when you have an expatriate, working with an expatriate that show those symptoms, you need to protect yourself. You need to wear a mask. For those showing that symptoms, you need to keep your distance. The moment you have symptoms suspected to be COVID-19, keep your distance, wear your mask, ensure that you observe your eye hygiene, and you also observe respiratory etiquette. This is not to say that people should be wearing masks henceforth. No, we don't have local transmission. It has not come. We are only having sporadic cases. And when you have somebody showing that symptoms, you need to keep your distance. But what is more important is get vaccinated if you have not done so. Hesitating to get vaccine is a huge mistake in public health, because the vaccine doesn't, and they are messenger RNA vaccine, and they shouldn't be worried much. So I will advise a non-vaccinated Nigerian to get vaccinated now. I will also advise a Nigerian working with close to a person with symptoms of COVID-19 to take the necessary basic precautions of masking, distancing, good sanitation, and also giving advice for that person.
All right, ensure you observe all the precautionary measures mentioned or highlighted by Professor Iwalokun. Thank you so much for your time on Sound Health. I have been speaking with Professor Bamidele Iwalokun, Professor of Biochemistry and Microbial Science, on the re-emergence of COVID-19 in Nigeria.
Thank you very much. Thank you for having me.
All right.
Thank you for having me.
You are most welcome, sir. Sound Health continues with trending health report from around the world. Please stay tuned. program is still Sound Health on Lagos Television. COVID-19 is real and is still out there. You need to protect yourself and your loved ones against the infection of the disease. Observe basic precautionary measures. Wash your hands regularly, at least for 30 seconds. Sneeze or cough in your elbows, and report symptoms early enough to the nearest health facility. You also need to get tested. You need to get vaccinated. The vaccines are safe and harmless. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035 826603 or follow us on social media at Lagos Television, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.